Hello class, my name is ClaireCullen and the topic I'm going to present to you today is on comparative effectiveness. So first, what exactly is comparative effectiveness? According to the Institute of Medicine, comparative effectiveness research is the generation and synthesis of evidence that compares the benefits and harms of alternative methods to prevent, diagnose, treat, and monitor a clinical condition or to improve the delivery of care. The purpose of CER is to assist consumers, clinicians, purchasers, and policymakers to make informed decisions that will improve healthcare at both the individual and population levels. In other words, comparative effectiveness compares how effective various medical treatments improve health outcomes. So I chose to do this on the first part of the Do One assignment for this topic, and the purpose of this assignment is to identify two patients in the table given to serve as match controls for cases, in which case is going to be patient 1 and patient 3. Select the possible controls randomly using the lowest random number provided. The matching will be based on age, and to create a Kaplan-Meier survival plot of patients without any falls. So here's the table given containing the data sample for the assignment. As you can see, the two lines that are highlighted in yellow represent the two cases where patients were given intervention for the medical problems. The other 7 patients that are not highlighted in the sample did not receive any intervention. So the patients that did receive intervention were patients 1 and patient 3. The patients that did not receive intervention were patients 2, 4, 5, 6, 7, 8, and 9. So the first thing we're going to do is to calculate the standard deviation for the patient's age. You can either use the standard deviation formula or plug it into Excel, which I find is much easier. To calculate the standard deviation in Excel, you must first type the equal sign and then start typing ST, and you'll see a drop-down box appear. From the drop-down box, select STVEV.S, which stands for standard deviation. Then select all the ages from the table and hit enter, and from there it'll give you the standard deviation. You should end up with 8.89. As you can see in this table, I highlighted patients from case 1 in green and the patients from case 2 in blue. After calculating the standard deviation, I then found that in case 1, patients 2, 8, and 9 fall the furthest from the standard deviation, and from this I calculated the lowest random numbers of 8 and 9. In case 2, patients number 4, 5, 6, and 7 fall closest to the standard deviation, and the lowest random numbers in case 2 are patients 4 and 6. After calculating the standard deviation, we must select the controls based on the lowest random numbers. To do this, we calculate the number of patients at risk of falling and the number of patients that are not at risk of falling. So here there's only 2 cases at risk, which are patients number 1 and patients number 3. So for the controls, we do the same calculations, but with different controls. And here there are 4 cases at risk. Now we can create the Kaplan-Meier plot with all of our data. I used Excel to create this plot. This plot represents the cases and controls over a period of 4 months. Introspection. So from this I learned that comparative effectiveness is an efficient and effective way to display patterns over time. These patterns can help you make important decisions, which in turn can save time, money, and most importantly, lives.